Hey, Nick, the health insurance guy. I also go, my real name's Nick Farron. If you're watching this video, it's because I probably gave it to you or you found it because you might be interested in being a health insurance broker. I'm a health insurance broker. I've been doing it for about 1.5, 2 years, and I really love it. The reason I'm doing it is because it offers a lot of freedom for my schedule. I have a major illness. I have kidney disease, and so I go to dialysis 3 times a week, Monday, Wednesday, Friday, for 6 hours each. So that's like 18 hours of my week where I'm stuck in a hospital. So having a normal job would be very difficult for someone like me. So I get a job like this, which allows me freedom of my schedule and my time, no boss, and allows me to be able to make money on my own terms. And I'm going to share this video with you for two reasons. First of all, because I really love my job. I love what I do. I want to share it with others, and I think a lot of people can benefit from doing a job like this. Number two is I actually make money when you make money. So if I can recruit more people and those people can become successful and I can help them be good at their job selling insurance, then on top of whatever commission you would make, I make a small percentage, which can help to grow my business and help me to be able to put more money back into marketing and increase the leads and stuff like that. So it's not a get rich quick scheme. It's not a pyramid scheme. You are licensed by the government and by the state, so it's highly regulated industry. But it's a win-win for everybody. So what I want to do is go through a few things. I want to talk about what is a broker. And then I want to go over the pros and cons of being a broker so that if you're interested in pursuing this type of job, you've got a good idea of what it's all about. Okay, because this job is not for everybody, but it can be for those who it fits right for who they are and what they want to accomplish. Okay, for what their goals are. And then I'll go through what a typical day looks like as a broker so you can get an idea of what it would be like if you actually were to become a broker. So let's start. I'm going to go through what's a broker real quick. First of all, a broker is a representative that assists the general public in purchasing the right products that fit their needs. So it's free for your clients to use, so you're not charging for your services. But they come to you, you listen to what they need, and then you go out there in the big world of insurance and you find what they need. Then you sign them up for those products. And they buy those products from those companies, not from you. So you're never gathering payment information that you're taking to pay for a service that you're providing. You're just connecting them basically to other companies. So you're the middleman. You're the guy in the middle that helps them to find it because you know what you're talking about, and they don't know anything about insurance. And so you learn about insurance, you help them find the right insurance, then you get them connected to the right insurance companies so that they can buy their products. So like I said, you're licensed by the state and by the federal government. You'll be offering the healthcare.gov insurance and also state individual private health insurance plans. So and now I'm going to go over the pros and cons of being a broker. So you can kind of see what it's like. Okay? Now, there's a lot of overlap between the pros and cons of being a broker. So when you see these, you'll see that a lot of them are very similar. Okay? So let's start. The pros of being a broker, you'll see the little notes I have right here on the side of the screen. Okay? The pro, obviously, is you are 100% self-employed. So if you're looking for a job where you do not have a boss, this is the job, okay? It is awesome. Before I did this, I was a stockbroker for E-Trade Financial. And when I worked there, I micromanaged, and I had to get there at 5 a.m. and stay until 2 o'clock. And it was a tough job. I don't like working for other people. I actually hate working for other people. So it was imperative that I found a job that I was self-employed. So that's definitely a pro for me. Having no boss definitely is awesome because I get to choose my own hours. I get to set my own schedule. I can work as little or as much as I want. Also, you can work from home. Okay. Now, I am going to be marketing this to a lot of people in my hometown, which is Katy, Texas, and Houston area. And if you are in the Houston area, I encourage you to come and work with me actually at my home office for at least a while so that you can learn about what I do and how I do it, and you'll grow a lot faster. But as soon as you're off and running and you know what you're doing, you can work from anywhere. You can work from a local coffee shop if it's quiet enough. You can work from the beach if you can get a Wi-Fi connection. All you need to do this job is a laptop and an internet connection, and you can do everything that's required. So you're very mobile in a job like this. You can work anywhere. You can travel. You can go get one of those. You can get one of those RVs or one of those little van life. You can be a van lifer. You can go travel around the country, and as long as you can get an internet connection, you can work from anywhere, anytime. And so that's the freedom and the power that a job like this has. And it's not some crazy weird thing like, you know, people approaching you for some type of weird job where it's not legit. This is, you know, I mean, you can't get more regulated than the insurance industry. And so this is a really, really good combination of good benefits for someone who needs to have the flexibility to work from home or work from anywhere. Maybe you have a spouse that travels, or you have kids that are at home and you can find a place where you can work quietly. This is the perfect job for that. So the pros are definitely very, very good. You can make residual income here. You can make as much income as you really want. I would say the average for the first year would be 30 to 50,000. Second year, 50 to 70,000. Third year, 70 to 100,000 and above. And the longer you stay, the more money you make because you're making residual income every year. And your income just grows and grows and grows as you continue to do it. So you're here for 3 to 5 years. You're going to be making usually a better paycheck than you can elsewhere. And this doesn't require any experience, okay? You don't need to have sales experience to do this job. Really, it's all knowledge-based, really. If you can understand and know your products, and anyone can learn that, then all your sales skills can be learned. You know, every book I've ever read about sales says that sales is not something that is you're born with, you learn it. And so anybody can do it. The cons of doing a job like this, and I'll be real because I don't want you to do this job unless it's the right fit for you, okay? The con is that you are 100% self-employed. Okay, so if you are not disciplined to work a set number of hours and stick to a schedule and stay focused, then you are not going to succeed at this job, and it's going to be a terrible experience for you. So if you know you need a boss to micromanage you, then don't do this job, okay? Because it won't work. But if you like the idea of not having a boss, this is perfect, okay? Like I said, no boss. If you don't have a boss, you're not going to be micromanaged, meaning if you decide to go watch YouTube videos all day and browse Facebook and go take a nap or, you know, do other things, hang out with friends, you're not going to get any work done. You're not going to make any money, and you're going to be poor, and you're eventually going to quit and go do something else. So this is the type of job that's for someone who's really dedicated to the lifestyle. And if you are dedicated to the lifestyle, it will work for you. A con is you're working from home where there's distractions. Like I said, Facebook. I've got a dog. I can take my dog out for a walk. I've got a really nice kitchen. I love cooking. I can spend a ton of time in my kitchen cooking. I can go and sit down to watch a movie during lunch and end up watching an entire movie. That's an hour and a half. You know, and so there's a lot of distractions here. And there's no coworkers. Okay, you're working from your home when you get to that point. And there's no coworkers, there's nobody to feel like you're accountable to, there's no one walking by your desk. So if you are watching YouTube videos or checking Facebook, there's no one that you're afraid is going to see you, you know, not being productive, you know. And so if you feel like you need that pressure of other people to keep you focused, then this might not be the right job for you. So, but if you can stay focused and you're not going to be browsing Facebook all day and Instagram, then this is great. This is a great job for you. Okay. So it's like an office call center job. So if if you've ever worked in a call center or you cringe at the idea of working in a call center, then you might not like this job because 95% of this job is on the phone with a headset calling people. Okay. So it's not going to be fun for you if you don't like making phone call after phone call after phone call, leaving voicemails, so on and so forth. It's just not going to be something you're going to enjoy. But if the benefits outweigh the disadvantages, then you can make it work. I don't like making calls every day. I don't like having to be on the phone for hours and hours. But I love the idea of being self-employed, not having a boss, setting my own hours, working from home, and being flexible and eventually being able to travel around the United States and still have a job. So I can deal with the phone calls because I love the freedom that this job gives me. So, like I said, if you're not disciplined, you'll never work. If you don't work, you don't make money. Okay. This is a get rich quick or not a get rich slow game. Okay. It's not a get rich quick. Okay. So I do not expect you guys to suddenly take this job and, I'm selling insurance, I'm going to make a ton of money my first year. No, you're probably going to make $2,000 to $3,000 a month. Okay. That's probably going to be your first year. Your second year, you'll make more. And then your third year, you'll make even more. And fourth and fifth and sixth and seventh and eighth. There's someone here that has been working here for about 8 years. And she's making $600,000 to $700,000 a year. Okay. So there's potential for you to make a lot of money if you just stick with it. The people in this industry that make the money are the ones that stick past the first 2 to 3 years. And then once you get past that point, it's just every year becomes easier in this job because you have clients that come back to you year after year after year. So the more years you're here, the more clientele just automatically call you up to renew their insurance every year. And you have to work less to make as much. So it's kind of a cool thing. So don't expect to make much more than $50,000 to $60,000 a year until you've reached at least 2 years. Okay. Insurance licensing is required. Just means that you have to. This isn't a job you just. Oh, hey, yes, I'd like to do this. Next day you start the job. No. When you want to become a insurance broker, you first have to study. It's a test that's a booklet probably about that thick. You study the material, which takes you maybe a couple weeks. You can alternatively find in a big city, you can find some type of insurance class you can take. Usually it's a 2 or 3 day class. And then you take the insurance license exam. And then you have to take this at a regulated facility that they take away all your notes, they take away your cell phone, all that. And then you sit down, and it's about a 1 or 2 hour test that you take. And once you pass that test, then you can wait maybe a month or so and you'll become a licensed broker. And then you can start calling and selling. Okay, now in that meantime, we can be training you, getting you ready to sell. You can actually start making phone calls within the first week or two and start learning the process. But you can actually make a sale and put your name on it for the first couple of months probably. It could be sooner if you get your license back faster, if you're in a state where the license gets quick. I know Texas is slow, but any other state might be a little bit faster than Texas. So, and it does take a little bit of money to get started. This isn't free to get started. We don't charge you guys anything as a company, but you have to pay for your licensing. You have to pay to take your test. You have to pay to get contracted with the insurance companies. So it's a commitment. If you're doing this job, if you're taking this position, it's because you are committed to the lifestyle, you like the advantages, and you're willing to do whatever it takes to become it. And this isn't a note real quick is this is not a job that you take for 6 months and then change your mind. Okay, you'll have wasted a lot of time and money. This is a job where you look at everything about the job. You take in the whole opportunity and you say, I want to do this, and I want to make this a long-term thing. Because if you can make this a long-term thing, then it's really going to be beneficial to you. When I decided to join this company, I knew I was going to do this for 10, 20 years or more. So I was committed to making the lifestyle happen, to make this happen, because I wanted the lifestyle it could give me. So, okay, so that's the pros and cons. Let me see my notes here. Okay, so I'm going to go over kind of what it's like to be a broker. Okay, first of all, let me just share with you a little bit about the company that I work for. Okay, let me get rid of this. I'm going to get this screen up here. Okay, so let me show you how this company is organized. Okay, actually, I'm just going to do this. I'm going to go to that screen. I think it's this one. Yes, okay. Okay, so I'm going to shrink myself a little bit here. All right, so this is the main company that I work for. It's Healthcare Solutions Team, okay? Healthcare Solutions Team is the parent company. They're nationwide. They have hundreds and hundreds and hundreds and hundreds, maybe even thousands of agents, okay? So they're everywhere. It's a huge company. They were started back in 2007, and they have just exponentially grown. I think on Glassdoor, they're one of the top 100 companies to work for in 2018. So it's a great company. They do a lot to help us and to train us and educate us, so on and so forth. Now, the individual agency that you'll be working underneath is the Leb Insurance Group. Okay, and that's right here. Mike Leb is the head of the agency that I work for. You'll see in my logos, let's see. You can see in my logo here, I have the Nick, the health insurance guy, powered by the Leb Insurance Group. Okay, so Mike Leb is the agency owner. He's been working there he started this agency, I think, like 6 or 7 years ago. And he's, him and his wife, Sarah, let me see if I can find a picture of them. So this is Mike. He's eating his birthday cake. Let's see if I can find a picture of him and Sarah. Hey, there's me. Okay. I think I just passed one. Yep, here we go. Okay. So this is Mike. This is Sarah. Okay, they're the kind of the head of the agency. Mike is the head of the agency, and Sarah is the top agent. Okay, she's making really good money. Okay, and she's doing great. She has 3 assistants working underneath her. She has built her company for about 8 years, and she has 3 assistants who work full-time to help her create leads, to get appointments, and then work on customer service after, so that all she has to worry about is selling, 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 selling. And if you were to see her numbers and see the type of commissions she's getting, it would blow your mind. Okay, she's the epitome of what you want to accomplish, and she's only been doing it for 8 years. And she's close to my age. I think she's like 32, 33, 34, something like that. And so is Mike. Mike's a young guy. He's in his mid-30s as well. Adam's a little bit older. I think he's like 40. Adam is one of the top recruiters. He's a trainer. He's one of the guys that works in the home office. And you'll be working a lot with him if you start working with me. Because in my line of succession, I guess, it would go you, me, and then Adam. And Adam would be the one that you would work with for a while as well with me. So these are kind of the MVPs of the company that you'd be working with, and those would be the guys. You can see we do a lot of fun things as an agency. We do parties. We have meetings. Let's see. We get together. I think this one we did like a little race thing that was in their hometown. As you can see, the the ladies that work with us are very beautiful and they're fun to work with. And so, guys, if you're looking for a fun agency where there's lots of beautiful women, this group has a lot. Also, let's see. Here's me in the background here, but this is an award ceremony that we went to, and we are all part of. A lot of these people in this photo got a lot of high commissions for working with Healthcare Solutions team for years and years. So some of the guys in our industry got $90,000 bonus, annual bonus. One got $20,000 annual bonus. I'm not sure what the other ones got, but those are the two that I know of. This guy right here in the white suit, he is the head of the entire Healthcare Solutions team agency, or the company. Okay, he's the big guy. He's the one that started it back in 2007. Let's see. I wanted to show you something else. What was it? Oh, yeah, I'm going to show you a video. Okay, this is part of this award ceremony that I talked about. Let's see if you can hear it, too. You might be able to. So that was just a fun little video. We go on lots of let's see. In this industry, you go on a lot of trips. So you go on a lot of fun outings and trips with people, and you get rewarded for selling certain products and certain amounts of products, so on and so forth. You know, here's a picture. Here's some pictures of a company trip where if you sell a certain amount, you get awards. And there's Mike and Sarah right there on a cruise boat. And these are just examples of a bunch of the people who work with us that won this trip to go to Cabo San Lucas. Okay, a lot of the guys, there's a trip that they're going to go on in a couple weeks. They're going to go to Jamaica. And I did not win that trip this year, but there are a lot of people that have. And so this is kind of an idea of some of the fun stuff that we do as an agency. You know, we go out and have fun, party. You know, we work hard, we play hard. And that's kind of what it's like in the insurance industry. It's designed to give you freedom and fun and allow you to work as hard or as little as you want. And the harder you work, the more you're rewarded. That's just how it works in the industry. It's not a 9-to-5 job. So it's very, very different. So, okay, I'm going to go back here. Let me get my notes. Now I'm going to go over kind of what it looks like to be a broker, okay? I'm going to talk about the different things that we do during our day and kind of what the software that you'll be using would look like, okay? Here's an example. As you can see, this is a software program that we use here at Leb Insurance Group, okay? When you become a broker, you'll spend 90% of your time right here, okay? You'll see this right here. You'll log in. You'll go to your dashboard. This is what your dashboard will look like. Everything in red are things that you need to do in your day, and then the things in black have not become yet. So it's about 10:30 my time. You can see the last red one is 10:30, and then the next one is 11 a.m. because 11 a.m. has not happened yet. So when it becomes 11 a.m., this one right here will turn red, which means that it's time for you to do that task. So what we do is how it works as a health insurance broker is you are provided leads. You're not going to have to pay for leads. You're provided leads, people who have already expressed interest in health insurance. Okay, they've gone on the internet, they've called in, they've requested information, and they're just sitting there waiting for you to talk to them and call them up and schedule an appointment. Okay, so all these people right here, contact a lead, follow-ups, new leads. These are people that have expressed interest. Whew. Wow. These are people who have expressed interest and are looking for health insurance, and they're simply waiting for us to make an appointment to talk to them. So what I would do is I'd go to my lead marketplace over here, and I can purchase leads. So say I click on this, I've now purchased Taylor Henners. Okay, he is now one of my people that I can call. And I'm not going to use someone else. I'm just going to use my own. Okay. So I made my own account. This is Nicholas and Susie Farron. I'm not married, so I just made up some people. But you'll see name, address, city, state, phone number, email, so on and so forth, annual household. And then you'll go here and let's say that this is a new lead. Okay. And I'm going to call this person. So what happens is we have a program set up where we already have the script for whatever you need to say when you call and leave voicemails and talk to people. And so we have a really easy, simple setup so that you can just get started, start making money, start calling people, start setting appointments. And this is how it works. So you pick up this lead, you open up this lead box, you would call this person, and then when I call them, it'll show up on this screen over here. It'll start dialing that number. And then if they answer, I just say, hey, this is Nick, the health insurance guy. I got to know that you were looking for some health insurance. What can I do to help you? Very simple, right? They've already expressed interest. All you got to do is ask, how can I help you? If they don't answer, you simply follow this script right here. Okay? And that script will tell you what to say. Hey, this is Nick, the health insurance guy. I'm a benefit specialist here at Healthcare Solutions. I just received your request for health insurance quotes. I handle all the major health insurance companies in Katy. I also work with the Affordable Care Act. I just had a couple questions before I can get some plans over to you. I'm going to try to give you a call later today, but if you want to give me a call ahead of time, here's my number, basically. Talk to you later. And then down here it has it'll send automatic text messages. It'll send automatic emails. You can change the what you're going to be, your disposition. So if you contacted that person, you would put contacted, follow up. You can choose the date that you want to talk to that person, the time you want to talk to that person, and then you can just hit submit. And then it'll pop up on your screen when it's time to call that person again. Okay, so it allows you to get through a lot of people really fast. So it's easy software. The software is designed to make it simple. But 90% of your time is spent right here on your dashboard calling people. So if you don't like dialing the phone every day and leaving voicemails, then you're probably not going to like this job, because you're going to be, sometimes you'll call for an entire hour. And when you call for an entire hour, you may only talk to 5 people. But you may have made 70 calls and left 70 voicemails. So you can call. It's totally normal, but that's the name of the game. It's finding the needle in the haystack, and you do it every hour. So our follow-up program with people just makes it really easy for you to continually put a lot of people in your pipeline and talk to a lot of people. Let's see. All right. So once you find somebody who's interested, you'll need to gather some information on them. Okay? So that's where this would come in right here. As you can see, this portion on my right side of my screen here has a bunch of information. Let's see if I can make that bigger. Let's see. Probably not. Okay. We'll just deal with it. Let's see. Well, let's see if I can make it a little bigger. Okay. Here we go. Yeah, there we go. Okay, so once I find someone who's interested, I need to ask them some questions. What's your name? How many people in your family? How many people need insurance? What's your income? What's your zip code, date of birth, your age? Are you pregnant or planning on becoming pregnant? Do you have any pre-existing conditions? Do you have any medications? What doctors do you like using? Do you need dental? Do you need vision insurance? When do you want your insurance to start? Do you need prescriptions? Who else needs to be involved in your decision to buy insurance today? How often do you go to the doctor right now? Would you rather pay for a better plan or save money? Would you rather have a high or low deductible? What's really important to you regarding health insurance? What's your lifestyle like now? So on and so forth. Okay, so you just ask a ton of questions. I have a cheat sheet right here. And then once you add that information, you just simply put it into this system. And then, let's see. Go back to mine. You would simply copy all this information, paste it right here, and then you would hit save. And that would create this information right here in yellow. And it would be saved on that person's lead. Okay? So it's very simple. And then after that, what you do normally is you say, great, let me go ahead and work on some quotes. And once I get the quotes figured out, I will get them right over to you. Let's go ahead and set an appointment for a second conversation. And you can do that for later that day. You can do it for the next day, whatever works with that client. And then you come over here to create new quote. You'll hit next step. And then you'll simply get the right products, add the right price, keep saving. You keep adding more products, add the price. And then once you get done, you would, let's see, save it. You come out here. You'd be able to fill out all this information here, which would allow you to create a quote. Okay, very simple. We give you the entire process of how to do it. So it's easy. Then, once you have that, I'll show you what I've done. I've created a sample for you. Here's what a quote sheet actually looks like. Let me zoom in a little bit. So it'll have your picture, your information at the top, who you're preparing the plan for, and then it's going to go over the quote. Okay, like I have an Affordable Care Act plan versus a short-term medical plan. They have different products. You can see those. People are able to click on the individual products and learn more about what the products are about. And during this process, you're just going to be sharing this with them. This is a link. So you take the link here, you copy and paste it into an email and send it to them. And then they'll be able to look exactly what you're looking at, and you can walk them through all of this detailed information. And you say, okay, this is what your plan's about. This is how much it costs. You can see the price at the bottom here. And then you just explain to them what you found for them that meets their needs, and then say, this is your plan. Would you like to go with option 1 or option 2? And then they choose which option they'd like to have. And then you say, great, let's go ahead and get you signed up. So then you would go to a website like this, like National General. Okay, let's 77494. Okay, let's just say I typed in my information, my date of birth. And then you simply choose the insurance that you're looking for that person. And then you sign them up. It's very simple. It's not a very difficult program to learn and understand. You just hit enroll. You type in their email address. And then there's a lot of websites you would go to fill out an application. This is just one example. But then you type in their name, address, phone number, social, their address, so on and so forth. Then you'd eventually grab their payment information, and you would get them signed up. And then you send them an email saying, thanks for your order, so on and so forth. and then you get a commission. You would see it show down under here, under policies. As a policy that you just did for that person, you would see the premium, and then there's a way you can calculate your commission off of that. So it's pretty cool. It's easy, simple. What you're basically doing is we've outlaid the entire process from beginning to end. We give you leads for free. You use those leads to find, call and schedule appointments. Then you get those appointments, you talk to people, you gather their information, then you set another appointment to go over the results that you found, and then you show them the results and then help them pick a plan, and then you sign them up for those plans. It's very simple. You probably won't have to worry about buying leads for the first 1 to 2 years. They'll probably be free to you during that time frame. But the only expenses you have to deal with in the beginning are simply getting your license. So once you do that, you're set up. You're set up to be successful. We have the programs, the software, the stuff figured out here already. We have the software that will be able to walk you through the entire process from beginning to end for each client, and it's really easy. The hardest thing about this job is discipline to sit down to your computer and work day in and day out. If you can do that, then you can do this job. There's no experience necessary. There's no, we don't really care about your resume too much. We just care that you are committed to making it happen and you work hard. Because if you work hard, then we're willing to give you more leads. We're willing to help you out more. And we're willing to give you the support that's necessary to make it work. So once again, to go back to the pros and cons here, let me bring this up if I can get it to work. Oh, okay, I need to bring this up here. Here we go. Okay. Once again, the pros and cons. If you are interested in being self-employed, not having a boss, you want to set your own hours, have that flexibility. You want to be able to work from home, and you don't want to have an income cap where you don't have to, you get to promote yourself. That's the idea. And make as much income as you want as you continue to grow in the industry and get that residual income, then this is the job for you. And if you can deal with having to be self-employed and being your own boss, having to be disciplined and not have coworkers, and if you're okay with the cause and effect relationship, if you don't work, you don't make money, if you're okay with it being patient and taking 2 to 3 years to get to over $100,000 of insurance, of commissions, and then making $100,000 plus, as much as you want if you continue to work, and you're willing to go through the licensing that's required and the patience to do that, then this is a perfect job for you. So the idea behind this video is just that you can take a look at what I've done, what I experienced. This is my entire setup, everything. And then if you are interested in pursuing this, give me a call. Let's talk, and we can go over any other questions that this video didn't answer. Okay? Oh, I want to show you one more thing. I want to show you what my desk looks like. Okay, this is me working at my desk. Okay, let's see if I can just expand it. This is my office. Okay, I have this desk, and I have a couple screens. I have a couple extra screens over here just for other stuff as I need it. This is kind of where I put my calendar and other stuff, but this is an awesome desk. I love my setup. You can see a little bit of the green screen that's behind me here, right here. But I have a little mini fridge here. I have a printer. I have my desk, my screens, and right outside here, let me see if I don't know if I can because you won't be able to hear me, but well, I'll show you real quick. I'll show you real quick, but you won't be able to hear me, but I'll just show you that I'm in my home office. I'm in my actual apartment. Just one second. Okay, I just wanted to show you that I am in a home office. This is my home. I work at where I live all the time, and so um, it's really convenient. I can go out and just have lunch in my own kitchen, and then I can go back to work. So it's really convenient and fun. I'm single. I have no kids, but if you did have kids and a family and you needed to stay at home, this would be a perfect job for that. So anyway, thanks for tuning in. I appreciate it. I'm going to go back to this screen here so I can talk to you face to face. But I'm grateful for my job. I love doing this job, and I wouldn't give it up for anything. So if you have any questions, contact me, and then we can just go from there. Okay? Thanks, guys. I know it's been long, but I appreciate you hanging in there.